Hello and welcome to Burst TV. My name is Cody and I'm joined with some incredible folks here. We've been talking a lot recently about care for specific communities, and now we are going to talk about the disabled community and ways that dental professionals can make their experiences in op easier, more comfortable, more affirming, more safe. So if we want to go around, Nikki, let's start with you. Can you tell me a little bit about your professional experience as well as your connection, whether personal or professional, to the disability community?
Hi, I am a registered dental hygienist, a certified special education teacher, a board certified behavior analyst, and my brother in law, who has intellectual and developmental disabilities, lives with us and I help him.
My name's Trish. I am a dental hygienist, and at my private practice, I have several households of patients that come in, and I am the primary hygienist for them.
Hi, everyone. I'm Emily Ladau. I am a disability rights activist and the author of a book called Demystifying Disability. What you're not able to see in the screen is that I am a wheelchair user. So, disability is both a personal identity and a professional passion. And I'm really excited to get to talk about making dental care more accessible.
Thank you so much. I'm excited to get started, and I want to just lay it all out. First things first, disability is a huge topic. We are talking for maybe 20 minutes. We are only going to scratch the surface. And disability is a wide ranging term that includes developmental, physical, emotional, sensory disabilities. We're not going to get to all of it. We're going to do the best we can to make this a foundational conversation for folks, because there is a lot of miscommunication and misinformation and just lack of information for dental professionals and how to properly care for folks with disabilities in the dental office. So, Nikki, tell me a little bit about how you've experienced working with people with disabilities as well as working in the dental office. I know you said you had a combination of special education background, behavioral background, and dental background. How does that all come together?
So I had to stop working as a dental hygienist, and when I decided what to do next, I became a special education teacher, found out about applied behavior analysis, and that's where behavior analyst came in. And every once in a while, I've been able to combine the two.
Trish, can you give us a little bit of background on, as you're going through dental hygienist school, is there any experience that you have when you were in school of learning about people with disabilities and how to make their experiences in the dental chair more comfortable?
So in school, they didn't have a big focus on caring for people with disabilities. You have to complete different patients in your whole schooling process. So we did have a few patients that came in. Our school worked with a house that brought their patients in. Their residents in, they were our patients. So we got a little bit of experience that way, but they did not focus specifically on different needs. It was more just a learning experience in private practice.
Emily, can you tell me a little bit about your experience at the dentist? Was there anything that happened as you were growing up that was, if you're comfortable sharing, that was concerning or made you feel a certain type of way? Or on the flip side, do you have a dentist that you love and the office, does things to make you feel more comfortable in those settings?
I've never minded going to the dentist, but whereas most people seem to be uncomfortable with the actual idea of dental treatment, for me, what's most uncomfortable is getting into the chair and navigating in the office and figuring out how to be comfortable physically. So while I'm perfectly happy to get my teeth cleaned, it was the actual experience that was often inaccessible to me, whether it was that the office itself had a step leading up, and so we eventually had to look elsewhere because it was not accessible to me as I became more of a wheelchair user as I got older. Or once I would get into the office, it would be really, really narrow. It would be impossible to get my wheelchair into the office. I would have trouble getting out of the wheelchair into the chair. So I would say it was sort of a logistical nightmare in a lot of cases. And more recently, I have found that the most comfortable way for me to experience a regular dental exam is actually staying in my wheelchair. And I know that not all dentists appreciate that, but I have found that the places I've been are very, very accommodating in terms of saying, okay, you can stay in your wheelchair and we'll work with you and we'll work around the chair. Now, granted, I have a wheelchair that has a power recline to it and a power tilt. And so that is pretty snazzy. It's kind of like my own dental chair, if you will. So I'm lucky that I have that. It's definitely a privilege, and I'm able to use it in the office to make things more accessible. But I think what it comes down to is just being adaptable when a
Mm.
patient comes in who has a disability and asking them what they need and what would make them most comfortable. Because even though the term that is so often used is quote unquote special needs dentistry, I try to remind people that there's really nothing special about anyone's needs. Everybody has needs, and that's part of being a human. And there are plenty of people who have a much harder time going to the dentist than I do, and they don't identify as having a disability. And so there are many accommodations or supports that they might need. And that doesn't mean that that's a special need. It just means that that's what they need as a person to be able to be comfortable within that experience. So for me, it's just about that adaptability and flexibility that's always made my experience a really positive one.
And when you are searching for, let's say you move and you're searching for a new dentist in that area, do you have to go there first to see if they have a ramp? Do you call? Like, what is that process like for you? Because I imagine it's a lot of in-depth questions and things that people aren't used to hearing, unfortunately.
Well, funny you ask because I did just move and I am looking for a new dentist. So I know you didn't know that, but the setup was real. So yes, I am. I am in fact in the market for a new dentist, and I think I've been putting it off a little bit just because my concern is having to call and say, can you accommodate someone who is a wheelchair user? What is your process for that? Not only can I get in the door, but once I'm in the door, are you comfortable assisting me with navigating? Are you going to expect that I'm going to get into the chair? Are you going to ask me weird questions? I've definitely had people who even though they're medical professionals, have kind of made me uncomfortable in the moment just by asking questions that I feel are not relevant to the current exam. Certainly, I think it's okay to ask me about my disability, but I think within the context of the treatment that you're providing. So I am always looking for someone who is at least open to having a conversation when I first give a call. And then I'll go check out the office and I'll say, okay, this looks like the room is wide enough. It looks like I can go to the bathroom here if I need to, for example. So there's a bit of a mental checklist that I have when I'm looking for a new dentist. But if somebody watching wants to just tell me they check all the boxes already, I will take the dental matchmaking.
Amazing. Can you imagine? I would love that. Um, Trish and Nikki, tell me a little bit about like your experience within the dental office, and let's say you join a new practice. Is there typically like a conversation that happens between the hygienist and the dentist, or the hygienist and the office managers about handling these conversations about accommodations in the correct tone, or with the right information? Is there anything done beforehand, as you almost like an onboarding, right? Is there an onboarding for dental hygienists and folks that work in specific offices?
In my experience, no. When Emily was just talking about her experiences, it reminded me of a patient who came in who was in a wheelchair, and he was unable to, his wasn't so fancy, and he wasn't able to get into the chair. So I just went, okay, we're doing it in your chair. I mean, you do what you have to do. And I completely align with Trisha in her experience in dental hygiene school as well. You know, it's kind of the on the job. I just come from the mentality of what what would I like if I were in this person's shoes, which could be wrong sometimes, but you know, asking them what's best for you is always a great solution as well.
At my office, there really wasn't an onboarding per se, but my doctor built the office, and when she was building, she made it so that it was wheelchair accessible. So wide doors, wide hallways, rooms are big, and double entrances. So it was all made accessibility wise. And then as we were bringing more and more patients on, she just knew that I was comfortable with everybody. And I really follow, just like Nikki said, like how I would want to be treated, how I want my friends and family to be treated. So, you know, that's why, at least at my practice, I definitely handle all cases. And then we actually had a house call that has several clients there. They live there and they bring them in. And then they brought on their sister houses. You know, we just make it a family friendly, everybody is accepted experience there.
What are some things in your offices or Emily in offices that you've been to that you're like, oh, wow, they really thought of this? Because obviously there's ADA compliance and you have to follow rules, but there are some things that show you that there's more consideration taken.
As much as it's important to be mindful of the physical environment, it's also important to recognize that everybody coming in is coming in with their own individual previous experiences. And for some people, that could mean that they have medical trauma, and going to the dentist may bring up that medical trauma. I know that I'm someone who has engaged with the medical system many, many times. I've had lots of treatments and things pushed on me without necessarily being able to consent in the way that I should be able to consent. And so having a medical professional who stops and takes a moment and checks in and says, I'm going to do this, and now I'm going to do this. Is it okay if I do this? Are you okay? How are you doing? To me, that's really, really important. And I know that there are plenty of people who go to the dentist and then find that it's sensory overload. And so having a place where you can unwind from a sensory perspective, maybe not having the lights so bright all the time, maybe having a fidget toy that they can be holding on to or playing with, or a stuffed animal that they can hug or something like that. Just really being mindful of the fact that everybody comes to the table or the dental chair, as it were, with experiences that you might not know or be able to account for. And so you can create a more comfortable and less overstimulating environment simply by communicating regularly and with compassion, and also making sure that you have certain comforts available, like being able to quickly adjust the lights for a pause in the treatment, or like being able to give someone something to squeeze if they need something to squeeze. It's just those little things that are actually really big things that make all the difference.
Oh yeah, for sure. Trish, do you guys have anything in office that, you know, like a sensory toolkit or anything like that? And I would also love to hear how that's changed in recent years, right? Because unfortunately, 15, 20 years ago, these weren't the conversations we were having. We're lucky to be in a time where we are having these conversations. Obviously, there's still a lot of work to be done, but like sensory toolbox, I didn't know what that was 20 years ago. Can you talk a little bit about that?
Yes, so we do. We have little fidget toys. We have little balls that you can, squeeze, get out, any nerves. And then in our room specifically, we have volume adjust buttons for the music that plays. We have in the ceiling, it's bright fluorescent lights. Who wants to sit under that? So in one of our light panels, we actually have like pictures So, and there's different scenes. You know, one room has a hot air balloon. So you're not just staring at a light. It kind of relaxes you a little bit. And then we just ask. So I ask everybody, do you want to listen to music that's playing? Would you like to listen to your headphones? I have a couple patients that I actually put on playlists for them, and I keep it. I know what they like. I have it on my phone. I can pull it up immediately. So I'll play that, and it just helps to relax them. We use a Cavitron. That's a high frequency. It makes a high pitched noise. Some people do not like that, and it can set off triggers, emotions. I don't use that, and we stick to hand scaling. Or patients that, you know, some people have aspiration issues. So if they have any of that, I don't use any water flowing devices. Just to being mindful of all that, you know, asking them specifically, or if I have a caregiver that comes with them, I ask them, you know, what are considerations that I need to know, and just kind of base treatment individually.
I'm going to ask a hard-hitting question. I know I said I wouldn't, but I would love to know, Nikki or Trisha, for either of you, when was the time that you got it wrong, and how did you make that adjustment and not overcompensate? I'm one of those folks that I can't just say sorry and walk away, which is what you are supposed to do. I overcompensate, and that in itself can be disrespectful. Would love to hear if you're comfortable sharing how you handled a situation.
It's admitting your fault, say you're sorry,
Mm-hmm.
and how to remedy it. You know, ask, what would you prefer? I'm sorry I did that.
Emily, how do you know when someone does it incorrectly, besides like the feeling in your body of disgust and, feeling disrespectful and dehumanized? Are there certain things that our community of dental professionals should know, like top 5 things, like do not say that to me, if you're comfortable sharing, of course.
You know, I try to take the approach that we live in a world where we don't give ourselves enough grace when we make a mistake.
Mm.
And I recognize that most people are very well meaning, and most mistakes are not intentional or malicious. And might they cause harm? Yes, but at the same time, what's more important to me is that you take that and learn from it. So sure, I could give you, things not to say, and sometimes just in my case as a wheelchair user, it comes down to like, wow, you really know how to drive that thing, or just things that I've heard so many times, and I think they're very well meaning, and it's not offensive, but it's also not funny. It's just kind of an unnecessary comment. And there are plenty of comments beyond that that are relevant to people with other types of disabilities. But rather than a what to do and what not to do in this case, I think really what it comes down to is if somebody is expressing that they're uncomfortable to you, or if you see in their body language that they're expressing discomfort, just say, I'm so sorry, I apologize. Is there something different that I can do or say? And so, look at it as a learning experience. The most important thing to me is just that you are communicating with me as you would with anybody else. You are not treating me in such a way that I feel like you're walking on eggshells around me. Just treat me
Mm.
like a human being.
The eggshell thing is very interesting.
That is something that hits me hard with my brother-in-law. We go places and he's 55. He's an incredible person. And people are like, it's that I don't even know how to put it into words. It's just talk to him like you would anybody else. He's not a little kid. He isn't of diminished capacity. He just talk to him like anybody else. He's not a pet. He's not your mascot. Um,
Ooh, yes.
he is a person, and just speak to him the way you would anybody else.
Trish, have you ever had an experience where the person working the front desk or the office manager came to you and said, "Oh, this person's coming in today with that like undertone of there's going to be some issues or you're going to have a hard time." Um, how did you deal with that situation? And then how do you communicate to the rest of the office staff that like We don't need to be talking like that.
Yeah. So when we first got a phone call from a facility that wanted to bring their clients in, the front desk came back and asked me if I was comfortable, and I said absolutely. And the way that it was like kind of brought on was like, are you okay with this? Are we going to be able to do this? And I said, absolutely. You know, we're going to do what we can do, and go from there and see what not only what we can do, but what do they need? Can we provide services? And or if we need to refer them, who are we going to refer them to that we would feel comfortable sending them? And then when the patients came in, um, you know, it's not scary. It's not something to worry about. I just create, like, I love to create the relationship with them. Um, you know, the patients that came in, they have significant needs that needed to be addressed. And it's just finding that comfort ground for both of us, and making them feel comfortable. A lot of them came from really bad experiences, and you know, you could see the nervousness. And their caregivers were also very nervous. They want them to be comfortable. So don't scare yourself as a practitioner before even getting into it. You know, meet the patients. And, you know, these things aren't something that you can't like overcome. You know, you go in, you treat them, and you do what you can and what they're comfortable with, and it's fine.
Nikki, I'd love to hear your advice. If you went back into the office and worked again as a RDH and wanted to do some community outreach and care, where would you start?
I would probably start in the acronym, intellectual disability and developmental disability, autism arena, because I've worked with individuals in that arena more than anybody else. I I think one thing that's super important, no matter who it is, but especially for individuals with those disabilities, is to gauge where they are. Emily was touched on that. And if you need to cut an appointment short, cut the appointment short. Not all offices are keen on that. But if you need to bring them back, they need to come back, because if they're not comfortable, it's it's not okay. It's not really beneficial for anybody and could be doing more harm than good.
I think it's important for our community to hear that, yeah, these are things you have to think about and things that, take time and learning and mistakes being made. And I hope that that sort of message is felt through this conversation. I know it has with other conversations we've had. Emily, talk to me a little bit about your podcast and how you hope the conversations that you and your co-host have sort of connect some of those dots for people and be able to empower them in a way to find the connections between the disability community and their professions.
One of my really good friends, Kyle Kachdurian, and we host a podcast called The Accessible Stall, and we call it that because there's room for everyone in the accessible stall, the accessible restroom stall. And we both have physical disabilities, and our priority is really to amplify our experiences and also to provide platforms for conversations about disability in general, so that people who maybe don't feel like they know how to enter that conversation, who feel like disability is scary or unapproachable, can just listen to us having a conversation and feel as though they are part of that conversation, feel as though we are talking with them rather than at them. I know that it can feel overwhelming at times to engage in conversations about things that are unfamiliar, but at the end of the day, we're just two people who are sharing our experiences. We can't speak for the whole of the disability community. There's more than a billion disabled people around the world, so it's simply not possible for anyone to speak to all of those experiences. But we really prioritize talking about things through our specific disability lenses in such a way that no matter what your profession is, no matter what your background is, you are also welcome in the accessible stall just to listen in to some of what we think it's like to be disabled and what we wish people knew about having a disability. So, regardless of what your background is, regardless of where you're coming to this from, I think it's really important to dive into media created by disabled people, because that is one of the best ways that you're going to learn or supplement any minimal education that you might have gotten, in dentistry or dental hygienist school.
Well, this has been an incredible conversation. I think there's so much more to tap into, and probably viewers have tons of questions. If you have questions, viewers, pop them in the comments below. We'll be in and out at answering some here and there, and hopefully we'll get to continue this conversation because it is so deeply important. And I think all the folks on this call here have a giant heart and want to keep opening themselves up and educating people. Emily, where can people follow you and learn more about you and your podcast? And your book.
I would say the easiest place to go is just my website, which is emilyladau.com. And it's got all the information about my book, the podcast, and how to find me on social media. I'm pretty easily reachable and always happy to hear from people.
Awesome. Well, thank you so much for watching, everyone. Reminder in the comments, drop your questions. We'll answer them. And we'll see you next time.